Thank you for the opportunity to explain how image stabilization can be used to help diagnose pseudoarthrosis. Image stabilization is where one vertebra is held in a constant position on the display as flexion and extension radiographs are alternately displayed. Image stabilization helps to appreciate relative motion between adjacent and stabilized vertebrae. In this video, we will use the convention of displaying the stabilized vertebra C6 in this example, with cyan-colored landmarks, and all other vertebrae with magenta-colored landmarks. First, always check for good motion at adjacent levels. This is required to assure that the spine was sufficiently stressed to allow for reliable fusion assessment. The motion at adjacent levels provides an estimate of the motion that the fusion surgery needs to stop. Next, look to see if the two vertebrae are moving as one rigid unit. That is the technical goal of fusion surgery. You should see no relative motion between implants and bone that can't be explained by differences in radiographic projection. With a solid fusion, as in this example, you might occasionally see some slight motion between spinous processes. Like wood and other materials, bone is an elastic material and can deform under loading, and you can occasionally see elastic deformation of the posterior elements using stabilization. When the level is not fused, you will see motion between spinous processes as expected. When the level is not fused, you will also see motion between vertebral bodies as expected. When the level is not fused, you will often see relative motion between implants and bone. This may include screw toggling. Cervical vertebrae can have prominent uncovertebral joints. You may have to look through these to assess for bridging bone between vertebral bodies. Image quality is not always great in clinical radiographs such as seen here. Motion assessment can be very helpful in these cases. Quantitative metrics are introduced starting with this case. Both intervertebral rotations and maximum disc strains are shown. Disc strains are used for fusion assessment based on the fact that there can be no bridging bone if the strains are greater than the failure strain of bone. This paradigm is explained in a manuscript on Research Square with the title, A Paradigm for Diagnosis of Spine Pseudoarthrosis. The paradigm is also explained in a YouTube video that can be found at the link in this slide. Although additional evidence is needed, here are some general guidelines based on the current knowledge base. The first step must always be to check that the spine was adequately stressed. Checking for at least 10% strain and 5 degrees of rotation at adjacent levels is one approach. If that test is passed, then if strain is under 4% and rotation is under 1 degree, the level is likely fused and it is not essential to check stabilization. If strain is over 8% and rotation is over 2 degrees, it is likely not fused, and again, it is not essential to check stabilization. However, stabilization may help in discussions with your patient. If strain and rotation are between these limits, stabilization should be used to help determine fusion status. Do you think this level is fused? It was read as fused by radiologists who did not use stabilization. However, with stabilization and the quantitative metrics, this level is diagnosed as not fused. Note the gaps between the graft and end plates, and the changes that occur between flexion and extension. Rotation is over 2 degrees, and that indicates pseudoarthrosis. And in addition, strain is 16%, and that is way above the failure strain of bone. What about this case? There is definite spinous process motion, more than can be explained by elastic deformation of the spinous processes. There is also interbody motion. Will this progress toward complete bridging given more time? This is a 3-month exam. Here are the metrics and stabilization at 12 months. The metrics and stabilization confirm fusion. Thank you for considering how image stabilization, combined with quantitative metrics, might lead to more accurate diagnosis of pseudoarthrosis after spine fusion surgery.